Welcome to some good news from Independence Anesthesia. Hi again, I'm Ed Long, founder and CEO of Independence Anesthesia. In this week's video, we'll be covering very promising information from around the country and the world with direct implications on getting CRNAs back to work, potentially before this summer and fall, as some had previously estimated. As you can see, we've learned recently that the 7-day growth rate of new cases in the United States appears to be slowing, thanks largely to some metro cities starting to level off. New York definitely appears to be easing on both new confirmed COVID cases and on COVID-related deaths. Following right on the heels of that amazing news, as COVID-related deaths dropped in New York to their lowest number since March, Governor Andrew Cuomo has said that some areas of the state can begin reopening for business and elective procedures as early as the middle of May. His administration is taking a measured, data-tested steps to return to business as usual, which also means getting CRNAs back to work. According to the COVID tracking project from The Atlantic, in some states where positive or negative results have appeared to have a one-day spike, it may actually be that they finally finished clearing a chunk of backlog tests, as with California. There's also continued news of cases decreasing in France, Germany, Netherlands, Spain, Italy, and other places. The hopeful outcome is that the trend following through while they start opening back up again. Now on to jobs. Pennsylvania and Ohio are moving forward towards elective surgeries as soon as possible. Ohio can begin outpatient and dentistry electives this Friday, and other procedures will be phased in after that. In Pennsylvania, facilities can proceed with elective surgeries once staff have access to adequate PPE and if the facility can still respond to a spike of new COVID patients without having to go into full crisis mode. This is similar to New York Governor Cuomo saying that facilities must have 30% open beds, both ICU and standard. Of course, they will take a slow, phasing strategy to it, but they will certainly ramp it up as soon as they safely can. West Virginia's executive order made Tuesday, April 28th, their first possible day to reopen electives and requires testing of employees and patients. How are you? Please comment below about whether you are open to returning to work and under what conditions. As for us, we at Independence Anesthesia promised no job blast emails until we had more to go on for solid positions. That time is coming, perhaps as early as next week. We have more hospitals and groups every day asking for CRNAs. We are reaching out to CRNAs individually this week rather than blast email jobs because the situation is so rapidly evolving. But please, feel free to use the link in the description to let us know your availability. We are always ready for immediate phone calls as well. While it is not yet the massive wave of jobs we've had in the last few years, we are getting calls for work in Kansas, Ohio, Virginia, Maine, Maryland, and other places. Some of these are permanent, but 90% of these are locum tenens solid opportunities. And for the vast majority of our jobs, we take care of travel, hotel, and any new state licenses as needed. In terms of these update videos, we may slow things down a bit once the jobs start ramping up hard again. But we'll continue to keep you informed with news, stories, and updates, as well as sharing information about locum life in general, best practices in a 1099 or an LLC situation, and the occasional laugh as we get back to normalcy. Just as importantly, though, we want to hear from you. If you like this content, press the like button, subscribe, and share your news and stories with other CRNAs. We are all in this together. Thanks for tuning in, responding, and keeping the dialogue going. We'll see you next week.